cardiology. He introduced primary angioplasty for management of heart attacks in the region, and having served as an additional professor at the prestigious PGI Chandigarh, he was the first in the world to show the efficacy of stenting for the management of patients with Takasayu arteritis. For his excellency, he was awarded, if we can have an applause for him. For his excellency, Dr. H.K. Bali was awarded the Kataria Memorial Gold Medal in 1985, the highest Cardiological Society of India, for being the best young investigator of the year. Sir, I would like to hand over the mic to you for your keynote address.
Thank you. At the outset, I would like to thank Mr. Vivek Atri for inviting me for this lecture. And what I'm going to talk about today is excellence in medical, excellence as a medical professional. All of you would have known doctors treating patients, carrying a stethoscope, or trying to take care of patients by the bedside or in the hospital. What I want to tell you today is medical profession is a much larger domain today than it was about 30 years ago. A medical professional is a teacher, he is a researcher, he is an academician, he is a leader of group of people, he could be an entrepreneur, or he could be a policy maker. And that's what it is going to be in coming years to come. When we look at our own country in the last 20, 30 years, we have grown up listening to shortage in different things. Shortage of resources, shortage of infrastructure, shortage of trained manpower. But the biggest shortage which I feel India suffers from is shortage of leadership. And when I say leadership, it is not necessarily the leadership which we daily listen to. There are enough political leaders we have. We have shortage of leaders in education. We heard about that a little while ago. We have shortage of leaders in health. We have shortage of leaders in policy making. And that's what area we should be concentrating on. So when we talk about medical excellence or medical education, I'll try to tell you how has been my journey be and how I think excellence should be in medical education. I don't know, I would leave it to history to judge how I have performed as a medical educationist. But my concept of excellence in medical education or medical field would mean that the person has to be perfect in his trade. By that I mean the person has to be fully proficient in whatever specialty he's doing it, be it neurology, gastroenterology, or whatever. My own field is intervention cardiology. And I think unless you are at the top of your game all the time, every moment of the time, you can't be a leader of men. Because unlike other fields, for example, we're very fond of cricket. We have had captains like Mike Brearley and maybe KL Rahul and others who could be leaders, but in medical excellence, you need to be a leader who leads from the front. A leader like Kapil Dev, who leads from the front by self-example. A leader like Imran Khan, I'm talking of leader Imran Khan in the cricketing field, not in the political field. So in medical profession, you have to be very good in your trade, doing what you do best. That's the first and foremost thing. The second part is that you have to have a credibility and you have to have an integrity. I was talking to Mr. Banerjee a short while ago, and he mentioned to me that medical profession all over the country, in certain parts of the country, has its credibility issues, has integrity issues. But I think if you do not have integrity or credibility, you can't be a good doctor. You can't be a good professional. And how does it matter to me? Because I think over the last 30 years, the only thing which I have tried to build up is credibility and integrity. Few days back, a patient came to me. We were doing the angiography, and after angiography, we found that the patient had a 3-vessel disease. There was a blockage in all the 3 arteries. And as normally would happen, we can do an angioplasty in such a patient, or we can do a bypass surgery in such a patient. And we normally shift the patient to the ward and try to discuss with the family what are the best options for that particular person. That's what I intended to do. And when I came out, I told the attendant of the patient that this patient has 3-vessel disease and both options are available. We will talk about the advantages of bypass surgery, we'll talk of the advantages of the angioplasty, and we will do it later on. And he said, no, Dr. Saab, आप कर दीजिए जो आपने करना है. So I said, no, we are not going to operate on now. I'll shift him to the ward. We'll have discussion with you on pros and cons of this procedure, and then we will do whether bypass is to be done or angioplasty. नहीं डॉक्टर साहब आपने कुछ करना है जो कर दीजिए. I again thought that probably he has not understood me. So I'll explain to him that there are advantages of bypass surgery, there are advantages of angioplasty, and we need to do which particular procedure would be best for him, and we need a discussion for him. He said, no, Dr. Saab, aapne jo karna kar do. So I got a little perturbed. I said, please, young boy, come and sit with me. Tell me what you are talking about. Why are you so insistent ki jo karna kar dijiye? And the answer he gave him told me what credibility means and what integrity means. He said, when we brought my father to you, my grandmother had told me कि जो डॉक्टर बाली कहेंगे वो कर देना, कोई सवाल नहीं पूछना. So that's what credibility and integrity means. And it is developed over a period of time, not in a short while. मुझे राहत इंदौरी का शेर याद आता है, and this is specifically directed to Mr. Banerjee. आहिस्ता आहिस्ता मेरे अंदर से सब कुछ हो गया रुखसत. आहिस्ता आहिस्ता मेरे अंदर से सब कुछ हो गया रुखसत, एक चीज बच गई है जिसे ईमान कहते हैं. So therefore, integrity and credibility is something which is essential for a medical professional. It is essential to guide people. It is essential that people have confidence, because in medical profession, unlike any other profession in the world, people come and allow you to touch their body, touch their parts, and confess everything. So therefore, unless you have that credibility and integrity, you can't do your best. So that's the second capability which a doctor or a medical profession must have. The third capability which a doctor must have is that he has to be decisive. That whatever decision he has to take, it is not philosophical call when a patient is on the table and you're doing a procedure and you can't debate on should I do this or should I not do this thing, what are the options here, what are the options are not there. You have to be very decisive and you have to take responsibility for that decision. And that decision could make a difference to the life of a person, or could actually decide about the life of that person. So you have to be very decisive about that decision. And how does that decision comes about? That comes from knowledge, that comes from experience, that comes from common sense, and that comes from taking a totality of the patient's lifespan into picture. And that is a momentary decision. And as I often take example of cricketing field, because there's a lot of commonality between cricket and medical profession. When we see Virat Kohli playing a cover drive, I think 2 days back, he played a shot over the mid-off region. And this, I think it was Faf du Plessis on the other side. And he was also amazed at the shot which he had played. It was such a brilliant shot. And we also got enamored. But we forget that hours, weeks, and months have gone into practicing that shot. For that moment of glory, that moment of excellence comes with hours and days and months and years of practice. That's exactly what happens in medical profession. When we perform an angioplasty or a valve replacement or any endovascular procedure, the momentary decision at that time is based on months and years of experience. And therefore, the same thing has been practiced so extensively that for that particular movement, there is a chance of its failure or next to nothing, because that is what makes difference between life and death. And therefore, the other quality is that you have to work very hard, repeatedly, and day in and day out to deliver at that particular moment of time. The other thing is that one has to take responsibility for the decision what one has taken. You know, medical profession has evolved. It's no more dependent on one single person doing procedure or an operation in a theater. It's a team effort. There are multiple interventionists. There could be a cardiac surgeon, there could be an anesthetist, there could be a technician, there could be nurses, there could be even GDs in that theater. And things can go wrong. And things can go wrong which can make a difference. But it's important for a medical professional to take responsibility for the decisions which are taken. The decisions which are successful, which have given very good outcome, you can give credit to your team. But the decisions which have gone wrong, or where an error of judgment has occurred, it could have been because an error of judgment, because of a nurse's error, or a technician's error, or a junior person injecting something which you should not have, but the responsibility has to be taken by the leader of the group. And that responsibility makes that person have the capability to experience the confidence of your team over a period of time. So the responsibility has to be taken for furthering the progress of this outcome of patients. The other thing is that one has to be very confident, self-confident. You have to have belief in yourself. And unless you have belief in yourself, nobody else can have. Unless somebody has belief in himself, probably the only other person who would have belief in you is your mother. Other than that, unless you have belief in yourself, nobody else would have belief in you. And I'll give you example of a couple of things that how much belief makes a difference to an outcome in a particular thing. I remember when I was doing my MD medicine, I was appearing in my MD final examination, and 4 or 5 days later, there was my final examination. And at that last moment, a few days earlier than that, we had elections in our Junior Doctors Association. And I was studying in my room, and one of the doctors, who is presently the head of the department of ENT at PGI, he came to me, and he said that I am standing for sports secretaryship, and please come and propose my name for the secretary's job. I said, okay, I will go to the person returning officer and we'll file this thing. This was about half an hour before the date had to finish, or the last date was over. So we went to the room, and there was somebody with whom I had a very love-hate relationship, the type of relationship which you normally see between Gautam Gambhir and Virat Kohli. And when we entered the room of the returning officer, and this person, the Gautam Gambhir there, I'm not saying that I am Virat Kohli, I'm only saying that I had an attitude of Virat Kohli. May not the capability of Virat Kohli, but the attitude of Virat Kohli. So I entered the room of the returning officer, and this Gautam Gambhir is lying on the bed, and he is saying, Bali, tu ki kar rahe the? I just come to proposed the name of this boy for sports secretary. Tu mera sports secretary ban ja. He shouted it. Gautam Gambhir said to me. So I said, what are you standing for? He said, I am standing for the president. I said, now I am standing for the president of the post. So I stood for the post of president at that moment, and the day later, we were supposed to address the general body about what changes we are bringing as the presidential candidate. And when I came to deliver my speech,